Welcome to Easy to Digest, your go-to podcast for all things health and nutrition. I'm Vanessa Rossetto, a registered dietitian and entrepreneur.
And I'm Benji Salter, a cardiac anesthesiologist. We're so glad you're here. On our show, we're going to cover topics like heart health, gut health, women's health, you name it, we're going to cover it.
Our goal is to make midlife wellness topics easy to digest. So join us as we dive into conversations with other experts, entrepreneurs, and patients.
And don't forget to subscribe so you never miss an episode. You can find us wherever you get your podcasts.
Welcome back to Easy to Digest. I am Tamar, the co-founder of Culina Health, and your host for this episode of the podcast. This is a very special episode with a guest and topic that are extremely close to my heart. I'm so excited to have Dr. Jessica Shepard on the show. And for those of you who don't know about her, which everybody should know about her after this, please look her up if you don't already know who she is. She is my shero. She is a board certified OBGYN, women's health expert, the CEO of Sanctum Med and Wellness in Dallas, and the newly appointed chief medical officer at hers. She's also makes regular appearances on shows like Good Morning America, Today, and she is on Culina Health's scientific advisory board. So we're really grateful to have her expertise and insight in supporting our business. And most excitingly, at the moment, she is the author of the new book called Generation M, which we'll be talking about today, and the founder of Modern Meadow, a community dedicated to supporting women through menopause. Dr. Shepard, welcome.
Thank you for having me. I just loved hearing all of that stuff. But the most fascinating part was, one, just, our friendship over the years, but being a part of the Culina team is, I do love that part because there's so much in what I do that, incorporates nutrition. And I'm so glad that I have Culina to be able to, one, refer my patients, but two, to be part of such a deep network who really understands nutrition in a different way. And that's what I always say to my clients, is that we're so used to what food pyramid and how it doesn't work. And I think that Culina has just done a beautiful job at helping people understand that their food choices can be modified. It doesn't have to be this complete eradication of what you have done in the past. And also bringing in cultural aspect to nutrition and allowing people to be who they are, how they've grown up, what they're used to in their food exposure, and just making those small adjustments that can get them on the path that they need to. So I really appreciate Culina for what it's done in the community and also for my patients.
Yeah, we really feel the same way. Dr. Shepard, you have embraced nutrition and lifestyle as integral parts of healing your patients. From a consumer perspective, the way that you speak about women's health, you really embrace lifestyle as part of that. It's not just about, medications and seeing your doctor. It's about this holistic lifestyle where you are, really integrating all of these components of health to thrive. And I think you do such a good job at synthesizing that into, no pun intended, like bite-sized pieces for this generation of women who are experiencing menopause. Of course, women have always experienced menopause and perimenopause, but I admire you so much for just creating dialogue and really normalizing this as part of being a woman and creating space for women to feel heard, for women to have tools to manage these things that aren't cost prohibitive, that are like relatively easy, small things they can do that have a big impact. And I think you say something in your book that really is so powerful. And that's, your goal is to help women live well and thrive through menopause and not just survive. So can you tell us a little bit more about that concept?
Yeah, just that is truly the concept of Generation M and why I was inspired to write it, but also in the creation of it. Like when we decided these are the chapters we're going to focus on. I really wanted to emphasize exactly what you said. Like, this is a lifestyle, and everything really feeds into another. When we think about nutrition, when we think about exercise, when we think about mindfulness, it really requires a true integration. And nutrition, I think for so long has been looked at as, kind of, what we're really good at is having two extremes in anything, good, bad, pretty ugly. And with nutrition, it's the good bad syndrome, right? Of
Mhm.
only these foods are good, these are all bad. Um, restriction. We live in a diet culture where it's so restrictive, but that really doesn't promote sustainability or consistency. And therefore, you're not getting the big outcome because all you're doing is restrictive, then full. So we go back to that pendulum swinging. So when we look at, especially going through midlife for women, perimenopause and menopause, there's so many biological things that are happening with our hormones that it changes how our body is able to respond to certain things. And so with that change in how our body is biologically going to respond, which many times is very hard to fix, I guess you could say, is allowing for the process to happen, but what are the things that I can bring onto or on board during this transition that's going to help facilitate what we're going through and the ease of that, or the integration of what my life can look like long term? And so I think for a long time, menopause was one thought of this very scary thing. And I wanted to be able to give back in the book a way that people will say, you know what, this process is 100% of women are going to go through menopause, but I
Mm.
actually get to have this type of information in a way that is reassuring and gives me confidence so that when I do go through this transition, I feel as if I'm empowered, I have the best knowledge, and then I can make better decisions for myself and habit change. And I know that you see this all the time with your clients, is that probably the hardest part of someone's life is behavioral change, right? Changing habits, incorporating new things, and being consistent with that. And that has to go a lot with nutritional intake and how you fuel your body, is not easy. So I never promise anyone that just, these are the these are the aspirations of what you would want from a nutritional perspective, but it's going to take time, but you still need that
Mhm.
empowerment behind it. And a lot of the book is shifted towards community empowerment and engaging people to know, I can do this. I really can do this.
And you're not alone, right? I
Yeah.
think something you said that was so powerful was this notion of acceptance.
Hmm.
I think we try to fight this because of the stigma
Yeah.
around, many menopause and perimenopause. There's so much stigma. Like, I think you highlighted a few horrible things that people say in the book, like you're
Exactly.
losing, everything. You're losing your
Right,
hair. Like
right, right.
you become undesirable. Like it's harder for you
Yeah.
to maintain weight as a woman. And I think that there is so much fear associated with that. And you reframing that as, an opportunity for you to establish a new community and
Hmm.
be empowered about the changes that are happening in your body, and really accepting that every woman goes through this, right? Truly every woman, where
Right.
nobody is
Every
unique to this
woman.
experience.
Yeah, right. And I think that in that experience is how we framed it as like this brick wall. Like everyone just hits this brick wall and it's going to be horrible. But quite frankly, everyone has a different um, experience going through perimenopause and menopause. So the goal is not to try and dictate what it's going to look like, but being accepting of when those changes happen, here's what I can do,
Mm,
right? And so that's really the agency that I want people to have is, yes, there are going to be chapters of this transition that are not great, but there are also chapters that can be, tolerated and done really well. And
mm,
what better way to do it with tools that you can do outside of the doctor's office? And I think that we've always kind of given perimenopause and specifically menopause this kind of notion that it's a disease, like, right? Like it's something bad. And that's where we start to become more dependent on medical attention during menopause because we think the only thing that it's going to appease it or make it better is medication or hormone replacement therapy. And a lot of people, there's controversy around that, and we can probably get into that later. But then if they couldn't do that, then it's going to be all bad. And
Mm.
that's why, especially when you were able to contribute to the book, which I thank you so much, your insight was amazing, is giving people this outlet, right? This outlet of something that they can do in their food choices and being creative and making some changes that can actually offset a lot of the bad experience, if you want to term it that, in menopause. Because there is data around that. There is data in the choices or the food choices that we make, or increasing our protein can help us in the long run. Some foods that can help with decreasing some of your hot flashes. So these are all things that we really need to look into the lens of the experience of menopause that often are overlooked or neglected.
Hmm. Yeah, I think about after I gave birth to my daughter, there's this extra special care you need for yourself after you give birth, right? And that is a time in your life as a woman that is extraordinary, right?
Mhm.
And I think there are some parallels there with menopause, right? How
Yeah.
can you give yourself extra special care during this
Mhm.
time that definitely lasts longer than childbirth, but
A lot longer,
a
right?
lot longer? Um, but that I think is all the more reason to sort of have that framework, right? Like this
Mhm.
is going to last a couple of years.
Yeah.
And how can I give myself extra special time and space and care to support
Mhm.
this journey?
Yeah, I think even with the slight notion that if I try to change my nutrition, if I try to work on my exercise regimen, is actually a form of self-care, right? Because in the end, your body will graciously thank you and be able to function better and can give you recovery and reserve and all of those things that actually in the end matter more, right? Because our health in the end is actually what is giving us our quality of life.
Hmm.
A lot of people are like, oh my gosh, you can be as rich as you want to be. You can be filthy rich, but if you don't have your health, then you don't really have anything. And
Yeah.
those steps need to be taken earlier rather than later. I always do say it's never too late to start, but if you do have the ability to start earlier, then the better off you will be. And it's kind of like when we think of finances, like no financial advisor ever says when you retire, then you should start saving money. No, you start saving money as early as possible so that when
Mm.
you get to the phase where you need it, then you have this availability, this bucket, this, kind of savings. But our health should be looked at in the same exact way. And when you form the habits early, then they will serve you so much better in the end. And that's what I want people to focus on is how do I want to show up later on in life? And I get to choose how to do that. And some of those changes need to be done now.
Yeah, that I think is so powerful. This sense of preparation, right? And
Mhm. Yeah.
it's not about, being paranoid or
Mhm.
it's not fear-based. It's about optimization. So
Yes.
if you could focus on like some core behaviors or foods or routines in
Mhm.
preparation for perimenopause and menopause,
Yeah.
what would be like your non-negotiable foundational sort of routines and habits to start?
Yeah, I definitely think that there are, and sometimes I get that question, what do they say? What is your power food? And I'm like, well, there's not really a power food. There are powerful foods.
Hmm.
But for me, some of those things are protein. And we touched on that in the book as well. And I think and I'll ask your opinion too, and I'm finished this question is it's not easy actually to get to the protein requirements that you need as you
Yeah.
start to get older. And the concept behind that really, and I think that it's important to establish the concept of why we hear this or keep saying this, is because when we have a decline, which can start early in your 40s of estrogen, you start to see that there's a decrease in muscle mass. And that just continues. It continues as we age. It doesn't just automatically stop. And so when muscle mass decreases or starts to decrease over time, and as you start to age, that really is kind of a precipitant of, or accelerant rather, of why you have certain diseases in the future, or decreased ability to do functional things later on in life.
Hmm.
So if you look at it from a disease progression, when we lose muscle mass, muscle is a huge absorber and utilizer of glucose. And so if muscle is already decreasing, but glucose is still accumulating, then one, that's going to increase your risk for type 2 diabetes, heart disease, etc. But also from the functionality standpoint, when you have a decrease in muscle mass, that is going to decrease the stability that it gives to your bones. And we all know that as you get older, your kind of ability to have flexibility and posture declines. And so that means you become more frail. But also just functionality from a standpoint of what I said earlier is like, how do you want to show up later on in life? If you are 80 and you're like, oh my gosh, I'm even 70 and I've retired and I'm going to travel the world, but you can't walk or you
Yeah.
can't like get your luggage up into the airplane, like then what really was it all for?
Yeah.
And if we have the ability to be strong when we're older, but also decrease our risk of disease, 7 out of 10 chronic diseases, in the US or can be preventable. And a lot of that has to do with our diet. So I always like to give that foundation of why we are always talking about protein, especially for women in the midlife region, is because our muscle mass is decreasing. And that's the reason why muscle is so important. But going back to that protein, and why I feel like it's one of the things that should be maybe a non-negotiable or a very important part of how you choose your food choices and fueling your body, is because it's not easy to get to that requirement, and that takes time, right? And
Yeah.
that's why I allow for the time, like allow yourself the grace of taking time to accomplish something. And with protein specifically, I like even me, as much as I talk about it, love it, I'm not even up to my protein requirements per day because it's like one gram per kg. And I'm like, man, that's a lot of protein. So there's a
Hmm.
strategy behind it, right? And so daily I'm like, okay, what food choices am I going to make? Where is that protein coming from? And how am I going to course it throughout the day so that I can get to close enough to what I'm supposed to be at? So that's going to take time for me to get there, but also to incorporate into my daily activity. So that would be one non-negotiable. And the other one is fiber. I think
Mm.
gut health is something that plagues a lot of people, whether they're in perimenopause, menopause, or not. Gut health is really impacting quality of life for everybody, male, female, and that has obviously a lot to do with how food is made, and also food choices because we do process our food a lot. And so then I think that just knowing gut health is then moving more towards a what can we do that's more plant-based, less processed, and also the preparation of our food. How much more can we prepare our food in the home rather than having it out? And if we do choose to go out, what are the food choices that we can make in where we go to eat, or if we're somewhere, how do we make better food choices from the menu? That again requires the expertise of what Kalina and the RDs there are able to provide. But that again is like just good overall information that people should have, because that if you're able to have the fundamentals of that, of how to make better food choices and why, then that shouldn't hinder you being able to travel or go out to eat with friends. It should just allow you to say, okay, for now it may be a bad food choice, dinner, but I know how to course correct. I know how to default back to fundamentally where I need to be when it comes to food
Hmm.
choices. And that again, so it's these longer intentional conversations than just saying, I always say doctors were great at hashtags. Sleep more, stress less, eat better.
Yeah.
But I'm like, but what does that really mean?
What does it mean?
I
Yeah.
don't, yeah, we are good with that. And we're like, and we'll see you again in a year.
I think that's where, this getting this interdisciplinary support, if you're a
Mhm.
patient or just a person who wants, some support on this journey, like
Yeah.
working with a doctor, working with a dietitian, working with a mental health specialist, working with,
Yeah.
someone who is a fitness specialist, right? And not
Mhm.
everybody has
Mhm.
access and means to that. And we're all doing our work to, move forward
Yeah.
accessibility for our industries. But seeking help, even if it's, a YouTube video
Mhm.
for a trainer that we all trust, who
Right.
specializes in this is, I think, really important. Like, you don't have to do it alone. And Dr. Shepard, as you said, these habits can be worked on any day.
Exactly.
And there's
Exactly.
no right or wrong answer. It's very much an iterative process where you try something. If it doesn't work, try something else. If it works, you keep doing it. But maybe, one approach that worked for you in the past
Mhm.
isn't working anymore. So you try
Yeah.
something new,
Oh, yeah, I mean, I think that's actually a lot what happens as we get into mid-age, is the things that were serving us very well in our 20s and 30s doesn't necessarily do that. And you'll find that as you get to 60 and 70, the things that you did in 40 and 50s didn't serve you well. But as long as it's a
Mhm.
continuing conversation in your head, in how you look at information, meaning making sure you're keeping current with what is going on, especially as you go through stages and phases of your life, and then also tapping back into resources. So I say this all the time. When I refer my patients to RDs, I always give them the notion of my goal is that I'm not expecting you to continue that type of resource or connection or relationship for like the next few years of your life. I want you to get substantial fundamental information, then you can offload, carry that, live. But when that changes again or something's not working for you, then you tap in again to that resource. The goal is to have
Mhm.
this Rolodex of people, experts, companies, whatever it is, so that when you need it, then you have access to it. I think especially, and you know this, in the health field, we've created like this codependency thing where we have kind of taken away the agency of people. And this is kind of like in the notion of how medicine was formed, that we create this codependency where we allow patients to think that they can't do without us. But I think the approach from healthcare professionals should be, I'm here to educate you, to fortify you, reassure you, to give you that confidence that you can go do some really good things and do them on your own. And when you need me, you come back, check in, go again, and create. That's what the relationship should really look like. Not,
Yeah.
okay, you're coming to see me. I see you for 20 minutes. Um, and then I give you really no information, no reassurance, and then you go live your life again the way that you were living it, and then come back to me in a codependent manner. Yeah, it really should be more of a
Yeah.
relationship, and you're checking in, and when things aren't working, you're, hey, where do I need to go with this? Yeah.
Yeah. So really supporting more self-efficacy. And I think,
Yeah.
Generation M, you in your forward, you do such a good job with sort of phrasing that. It's not about placing blame
Yeah.
on your doctor or society for, making this taboo, or your parents or your mom for not telling you more about it. It's
Mm-hmm.
like, while for many some of those things are true, at the end of the
Mm-hmm.
day, as a patient, experiencing this huge change in your body, you have to be able to advocate for yourself, and only you can do the work,
Yeah.
right? Your doctors can't
Yeah.
do it for you, your dietitian
Mm-hmm.
can't do it for you. We're here to support you in that process, but ultimately,
Right.
you have to be the one leading the charge.
Yeah, you have to make the change. And when you leave the office setting or the building, what have you created for yourself that can carry you on? Because you really are the captain of your own ship.
Mhm.
And the team approach is I go to my board, I ask for advice and what I should do next and how do I steer in this direction. And then you actually go and do that. And that's what I really like to instill in my patients that I see here in the office. But the book, especially, I think because we are hearing more about menopause now and perimenopause, namely, And there is a lot more information going out. There is still, to me, and I see it sometimes where it's still like a fear factor type of thing. Like there's this
Hmm.
horrible thing coming. And yes, a lot of the symptoms or experiences are not great. But I love to, how do we retrain the brain in the way that I know this is coming? There are some things with it that may not be great or pleasurable, but I know I can navigate through it. And I know that I have some really good tools to get me through that. Because it's not so much that there's going to be things that are all easy, but the real true test of resilience is when these things come that are not easy, what am I stacked with as far as to get through it? And how am I processing that message in my brain in order to get me to the other side of it?
Mm. Yeah, that resiliency. I mean, everything you just said speaks to that word that we started with, empowerment, you know.
Hmm.
I
Hmm.
think I think we're right back at that mindset for
Yeah.
empowerment. And I think that is such a great a great word to just continue to go back to as you go through life's ebbs
Mhm.
and flows, but especially
Right.
through this, perimenopause, menopausal journey. I haven't started experiencing it myself, and I know that
But
I
don't you
will.
feel it's
I feel better
insane?
though. I feel better
Yeah.
after talking to you about it. I'm like, I could do this. It's going to be
Right. Like I can do this
fine.
and it's coming and I don't have to fear it. Because the more we create this like fear of it, then people will fight it. And I've learned this even from like a personal standpoint of who I am, rough things in my life that occur is and nod to my therapist because I'm always advocating for therapy for everyone.
Not to my therapist too. Thank you
Right?
for your all of your work and service,
Exactly. I
and
know
all
you're
the
like, thank
therapists
you
out
for this.
there.
But I feel like even in when I go through my life and going through therapy is that resonates throughout all of our lives is in the moment of chaos and like hard times, not kind of sinking into the moment of what is being presented to you. Most times we're teaching people to fight it, like to pretend it's not there and kind of like push it down and ignore it. But that can't be the way that you truly get to the other side in a positive fashion. And again, in that resilient manner, it's kind of like sinking into the moment and saying, yes, I feel horrible right now, but I'm going to be accepting of it in the sense of I know it's here and I'm going to call it by its name and then I'm going to work on it versus, yes, menopause, I'm having a hot flash. This is not great, but I am going to accept it for what it is because this is my journey right now. Now, what am I going to do to help offset that versus, oh my God, I'm having a hot flash. This is horrible.
Hmm.
I don't know how to get through this. This is my life, because you start constructing this negative feedback loop. And I just think that women, as much as we go through, the more stress that we bring to this specific transition in our life, I'm really trying to change that narrative because for so long women have had to suffer in silence. And it's not saying that we won't have moments that feel insufferable, but one, I don't want us to do it in silence, but two, I want us to have the best tools and the positive mindset behind that to get to the other side.
Yeah, we will get through this.
Hmm.
There are challenges, and it won't always be comfortable, but our
Yeah.
reaction, the way that we react to that, can determine,
Hmm.
how easy or hard this is.
Yeah.
And that's where we have our agency.
Right. Exactly.
Well, this has been so incredible. I feel like I've gotten so many mindset,
Hmm.
shifts as part of this. And, you're a renowned OBGYN, women's health expert, and we're here talking about menopause and mindset. I think that just really speaks to your approach to health overall,
Hmm.
and to this journey, right? It's not just about seeing your doctor, but please do. So, on that
Right,
note,
right.
do
Still,
you
still see
have
your
some,
doctor.
yeah, still see your doctor. Do you have some specific recommendations as to who you should see, when you should see them from a medical perspective as you approach the perimenopause period and
Mhm.
throughout menopause?
Yeah, we're in the early stages of really appreciating perimenopause for what it is. I will say the body awareness, this goes in again to who we are and what we're feeling. The body awareness of I feel this going on. Was that a hot flash? Because in perimenopause, it comes in frequently, maybe not as severe as when you actually reach that menopausal state. So through your 40s and latter 30s, you might start to feel my sleep is not as great. My weight management or weight loss capabilities are not as easy. I may have a hot flash here or there. And so these things start to occur over time. And it's the body awareness of a lot of women realize it's happening, but they kind of like push it off. They're like, oh, maybe that wasn't anything.
Hmm.
I'm empowering women to being like, yes, these things are happening, so that you can actually take more tabs on what's going on. So that as they start to become more frequent, it gives you the momentum to say, yep, let me go address this now, because now it's happening more often than not. I would definitely say that physicians, we're not as well versed as we have been, but I do see an uptick in how we're approaching perimenopause, is that we are addressing it more, being able to recommend hormone replacement therapy if needed, whereas before we didn't do that at all. We'd wait till you're menopausal. And then the other thing I would say is when you do go talk to your doctor, if you do feel that that conversation of symptoms versus acceptance of it, yes, this is perimenopause. I understand. Let's give you some recommendations is not where the conversation is going, is to find another provider, if you can and you have that ability to who's going to appreciate the conversation a little bit better, so they can
Yeah.
guide you a little bit better than saying it's not or it's all in your head, because I've heard that a lot too. The last thing that I would say is it's not right now as easy to find a menopause specialist because we're just at the beginning phases where we're actually focusing on it as an actual like subset of gynecology. But the
Mm.
Menopause Society really has a very good, they certify providers, whether it's a NP or a physician on menopause specifically. So you can go there and they have a
This
direct,
is amazing. I had
yeah,
no idea that there
yeah.
were even, a governing society for menopause. This is incredible.
I
Thank
know,
you.
and a lot of people don't know about them. And then, but they'd have a directory in where these providers are by state, so that's helpful. And then also, I would say we do see now the telehealth platforms that are just devoted to midlife health, perimenopause, and menopause. So Alloy is another one that's really good. ALLOY, MIDI Health, MIDI. You have Evergreen, or Evernow rather, is another one, and then Winona,
Mm.
WINONA. So those are at least four platforms in where someone could at least start the process and saying, what would I do in this phase? What are recommendations? Um, so yeah, I think those are good places at least to get some ideas of who might be someone you can go to if you can't get that help from your PCP or your OBGYN.
Mm.
Yeah.
Yeah, there's a lot of innovative new companies out there
Yes.
who are working really hard to solve these
Hmm.
problems. But,
Yeah.
if you have a doctor you trust who is
Hmm.
having collaborative conversations about this with you, then
Yes.
they could also guide you in that. Really, really helpful. Let's talk a little bit more about where we can find Generation M. So,
Yes.
to supplement any medical support that you're getting from your own doctor, and if you're not in menopause yet, you're not in perimenopause yet, I think it's also a great tool to, just educate yourself. Like you said, got to start
Right.
early. And as soon as you do start the perimenopause menopause journey, this book is such a practical go-to guide. I mean, you're really speaking to the everyday woman
Yes. I
in
really
this.
wanted to make sure of that.
Yeah, there's no barriers in terms of access and with your recommendations. You really, I think, have provided such a good blueprint for every woman to be able to have really actionable takeaways that are not expensive, that, are not impractical. Like,
Yeah.
where can we find this book? Tell us
Yeah.
more about how we can get our hands on Generation M.
Yay! I would say you can go to Barnes& and Noble in store. It's carried in store and also online, Barnes& and Noble, Amazon, obviously. But also on my website. We carry it on my website, which is jessicashepherdmd.com, and that's SHEPHERDMD.com. But yeah, and we also have newsletters on my website that we kind of keep you up to date with what's going on. And we are working in 2025 to expand that platform to actually do more kind of in-person type, or, obviously through online, but availability to get some of the action items that you find in Generation M in more of a
Ooh.
conversational way, and in more of a community where people can gather and join and create more of the conversation that you see going on through Generation M.
Oh, that's an exciting
Yeah.
teaser.
Yeah.
Yeah, yeah. You mentioned community as such a big part of this, so cannot wait
Mhm.
for that, Dr. Shepard. We will have to have you back when that
Oh,
happens.
absolutely. Because you will have to have me back because you will be part of those conversations and
Yes.
lending your expertise as well. So that is my teaser to you that you will be part of that community as an expert.
Oh, well, I cannot wait. This has just been so incredibly empowering. I feel like a sense of relief just talking to you about this. I
Oh,
certainly have had all of the fears you have
mhm.
highlighted, and I think really embracing this journey as one that is unique and special, that has highs and lows, but is totally manageable. I think it's such a great message for our listeners.
Thank you so much. And I, again, love spending time with you as a friend, as a colleague, and also as an expert. So thank you.
Thank you so much, Dr. Shepard. We are excited to have you back in the future, and we will see you next time.
Thank you.
Thank you for tuning in to another episode of Easy to Digest. If you have questions or topics you want to discuss, send us an email at podcast@kalinahealth.com. We love hearing from our listeners. And remember, that's podcast@kalinahealth.com.
Yes, absolutely. We may be medical professionals, but we've also been through some real stuff ourselves. We want this show to feel like you're hanging out with your healthcare providers who can give you the inside scoop.
But hey, a quick disclaimer. As good as this podcast is, and as smart as our guests are, we are not here to replace your own medical providers.
That's right. So stay tuned for our next episode. And until then, take care and be well.